Welcome back, everybody, to the Deep Dive. This time, we're getting physical, exploring fitness across the lifespan. We've got our hands on a personal trainer certification course.
Yeah, like the one you'd use to, become a certified trainer.
Exactly. So we're going to see how fitness needs and approaches change from childhood through adulthood and beyond. Not getting certified today,
No, no.
just extracting some golden nuggets, insights that we can all use.
Right, yeah. I mean, when it comes to fitness, one size does not fit all.
Absolutely not. We'll uncover some cool stuff like how our bodies react differently to exercise at different points in life. For example, did you know that kids recover from exercise like way faster than adults?
Oh, yeah. It's pretty amazing.
It's crazy, right? We're going to break that down and more like the best ways to prevent age-related decline.
Oh, yeah, that's important.
Super important. And we'll even cover safe and effective strategies for exercise during pregnancy.
I'm looking forward to that.
Let's do it. So first up, let's lay the foundation. Youth fitness.
Okay, youth fit.
Setting the stage for a lifetime of healthy movement starts early on.
Right. You know what? It's not just about keeping kids busy. The physical activity guidelines for Americans are very specific. Children and adolescents need at least 60 minutes of moderate to vigorous physical activity every single day.
60 minutes. I remember as a kid, that was like nothing.
Right.
We'd be out there all day long,
Well,
building forts, playing tag,
yeah.
completely lost in it.
Right.
But it makes you think how much our lives have changed, you know?
Or it's not just running around like crazy, though. Think about it. Kids climbing on the playground.
Oh, yeah, yeah.
They're building muscle strength, better bone density, and their heart rate's up, all at the same time.
It's like a full body workout built in.
Yeah.
And I bet they're having way more fun than adults at the gym.
Probably, right?
Definitely. And speaking of fun, there's this cool concept called fundamental integrative training, or FET.
Right. FIT. I
Yeah.
like it.
FIT, what's the idea there?
It's all about combining that health-related fitness, so your endurance, strength, with skill-related components, so your coordination, balance, agility.
Okay, so instead of just, lifting weights and all that, it's more about developing well-rounded movement skills that kids can use throughout life.
Exactly. It sets them up for success.
Love that. Now, about that crazy recovery time for kids,
Oh, yeah.
what's the science behind that? Why do they bounce back so quickly?
It's fascinating. You see, at the same level of exertion, children, they breathe a little harder, have higher heart rates compared to us adults.
Yeah, their little motors are really going,
Yeah.
but they recover so much faster. I mean, I remember being totally wiped out after like a game of tag,
Yeah.
but give me 10 minutes, I was ready to go again.
Exactly. That's the beauty of youth. But remember, those 60 minutes of daily activity, they do way more than just tire kids out.
Absolutely.
Yeah.
So beyond the physical, what other impact does regular activity have on a child's development? What are we talking about?
It's huge. I mean, we're talking improved bone health, so important for growing, right? Lower risk of cardiovascular disease later in life, and get this. Yeah.
Studies have even shown a connection between physical activity and improved academic performance.
So, healthier body and a healthier mind. Wow.
It's a win-win.
That's amazing. Really underscores why encouraging active play and, making fitness fun for kids is so important.
Absolutely. We're building those lifelong habits, setting them up for a healthier future.
Love it.
You got it.
Great stuff. So hold on. Now let's switch gears a little bit
Okay.
and talk about fitness for older adults.
Okay. Older adults.
It's a demographic that's, sometimes overlooked, but with people living longer, it's even more crucial to understand how to stay active and healthy later in life.
It's essential. Yeah.
Totally. And I think there's a misconception out there, that decline is inevitable as we age.
Oh, yeah, for sure.
But is that really true?
Well, while our bodies definitely change as we get older, that idea that we're just destined to get frail and inactive, that's just not true.
Okay. But regular exercise can make a huge difference in slowing down age-related decline.
That's encouraging. What kinds of changes are we talking about here, specifically?
Well, we see changes in several areas: cardiorespiratory fitness,
Yeah.
muscular strength, body composition, which is the ratio of muscle to fat, and flexibility. Exercise can help with all of these.
So it's not about, like, turning back the clock.
Yeah.
It's about aging gracefully and staying independent.
Yes.
But how do those exercise recommendations change for older adults?
That's a good question.
I imagine there are some special considerations.
Oh, you're absolutely right. The first step is always a careful assessment.
Okay.
We need to understand their current fitness level any pre-existing conditions and their goals.
Makes sense.
It's not one size fits all, right?
No, definitely not. You wouldn't want to, like, push someone beyond their limits,
Exactly.
especially
Okay.
if they're new to exercise or have some limitations.
Yeah, exactly. And instead of relying solely on traditional strength assessments, we might use the rate of perceived exertion, or RPE scale.
Okay, RPE. Tell me about that.
It helps people gauge their effort level based on how they're feeling, rather than just a number.
So it's more about listening to your body
Yes,
than hitting some specific weight on a machine.
exactly.
Okay, I like that. And for older adults, we really want to emphasize functional fitness.
Right.
Okay,
That's a big one.
okay, so break it down for me. Functional fitness, what does that actually mean in, like, everyday life?
Well, it means focusing on exercises that mimic everyday movements.
Okay.
Think about the things you do daily. Carrying groceries, climbing stairs, getting up from a chair.
Yeah.
Functional fitness strengthens the muscles you use for those activities so you can keep your independence and do the things you enjoy.
So if you're struggling to get up from a chair
Mhm.
or carry groceries,
Right.
that's a sign you might need to work on some functional fitness.
Yeah, it's a good indicator.
It's exercise with a purpose.
Exactly. We often prioritize core strength too, to prevent falls, which are a big concern.
Yeah.
Low impact activities like swimming or cycling are great because they're easier on the joints.
Okay, so many great ways to tailor it.
Yes.
And it's not just the physical benefits either, right?
Oh, absolutely not. You're right. For older adults, exercise can help fight loneliness, boost mood,
Oh, I love that.
especially group activities or exercising with friends.
Yeah, that social connection is so important as we age.
It really is. Makes exercise less of a chore and more fun.
It's a social outing.
Exactly. You know what else we need to tailor recommendations for? Exercise during pregnancy.
Oh, good point. Pregnancy brings so many changes, both physically and hormonally.
Mm-hmm.
I can only imagine how that impacts, how you exercise.
Yeah, it's a time of huge transformation. As the baby grows, the center of gravity shifts.
Okay.
Joints get more lax because of those hormonal changes.
Interesting.
And the cardiovascular system is working overtime to support both mom and baby.
Wow, the body's amazing.
Yeah.
But, are there any risks to exercising during pregnancy?
There are some potential risks, so it's always best to get clearance from your doctor first.
Okay, that makes sense.
But in general, moderate exercise is considered safe and even beneficial.
Okay, good
Yeah.
to know. So what are some warning signs? Like, when do you need to stop and call your doctor?
Good question. Things like shortness of breath, chest pain, regular painful contractions, any vaginal bleeding or fluid leakage, those are all red flags.
Yeah, those don't sound good.
If you experience any of those, stop immediately and call your doctor.
Right, listen to your body
Exactly.
and don't mess around with that stuff.
For sure. Now, the guidelines recommend at least 150 minutes of moderate intensity activity per week.
100.
Sorry, for pregnant women. Yeah.
Okay, so it sounds like consistency is really key, both during pregnancy and as we age.
Yes.
Right.
Absolutely.
It's not about, pushing yourself to the limit every time.
Right.
It's about making movement a part of your routine.
You got it.
And, of course, the type of exercise needs to be adapted, right?
Right. We want to avoid anything with a high risk of falling or too much strain on the joints.
For sure. Are there any, specific positions or movements to avoid?
Yes. After the first trimester, it's usually recommended to avoid lying flat on your back.
Okay.
It can compress a major blood vessel.
Oh, wow. I didn't know that.
And of course, staying hydrated is super important.
Yep, always.
And choosing activities with a low risk of falling, like walking, swimming, stationary cycling.
So many good tips. What about after the baby is born? Can you keep exercising postpartum?
Absolutely. It's encouraged.
Okay, good.
A lot of people wonder about breastfeeding, whether exercise will affect it. The good news is it doesn't negatively impact milk production or the baby's growth.
That's good to hear.
Yeah.
It's just amazing how movement can be beneficial through all these different stages of life, even during these big transitions.
Absolutely. It really is. Now, are you ready to dive into how we can adapt exercise for people managing chronic conditions?
Absolutely. This is where the expertise of, a trainer really comes in, I'd say.
I agree completely. Chronic conditions can present some unique challenges, but they definitely don't have to be roadblocks to physical activity.
For sure. Let's start with heart disease, a condition that affects so many people.
Mm-hmm.
What are some things fitness pros need to know when working with clients who have heart conditions?
Understanding the basics of what's going on is crucial.
Okay.
Think of your arteries like highways. With heart disease, those highways can get clogged with plaque restricting blood flow. That increases the risk of heart attacks and strokes.
Wow, that's scary.
It is, and that's where exercise, specifically cardiac rehab, comes in.
So it's not about avoiding exercise altogether. It's
Right.
about doing it
Yeah.
safely and effectively
Yeah.
with medical supervision.
Absolutely. Fitness professionals need to be aware of the different phases of cardiac rehabilitation.
Okay.
It's a medically supervised program that helps people recover after a heart event, like a heart attack.
So it's about working as part of a healthcare team
Yes,
to
exactly.
make
True.
sure exercise is part of the recovery process.
Precisely. We have to monitor vital signs carefully, understand the impact of any medications, and adjust the intensity and duration of the exercise to fit their needs.
Really individualized.
It has to be.
Yeah.
Now, what about cancer?
Yeah, cancer. Exercise is being recognized more and more as beneficial for patients and survivors, right?
You're right. It can help manage fatigue, improve mood, and even potentially boost the immune system.
Wow, that's incredible.
It is. But again, it's all about individualizing the program
Okay.
based on the type of cancer, treatment side effects, and their overall health.
So once again, working with the healthcare team is so important.
Absolutely. Now let's talk about diabetes, another chronic condition that's on the rise.
Okay, diabetes. I know exercise is often recommended for both preventing and managing type 2 diabetes. How does that work?
Well, exercise improves insulin sensitivity,
Okay.
meaning your body can use glucose more effectively. It also helps with weight management, which is a big factor in preventing and managing type 2.
Makes sense. What are some things to keep in mind when working with clients who have diabetes?
Monitoring blood glucose levels is crucial before, during, and after exercise.
Oh, yeah, that makes sense.
And we need to teach them about recognizing the symptoms of hypoglycemia, which is a dangerous drop in blood sugar,
Yeah.
and how to manage that.
So being prepared is really key.
It is. Now, shifting gears a bit to pulmonary disease, these are conditions that affect the lungs, making it hard to breathe.
I imagine exercise must be particularly challenging for people with lung conditions.
It can be, but it's still incredibly important.
Okay.
There are two main types: obstructive, like asthma and emphysema,
Okay.
and restrictive, like cystic fibrosis.
Got it.
Exercise, even modified, can improve lung function, strengthen those respiratory muscles, and enhance overall quality of life.
It's about breathing easier and moving more freely.
Exactly. And finally, let's touch on osteoporosis. This condition weakens the bones and increases the risk of fractures, especially as we age.
Right. And I know weight-bearing exercise is often recommended for osteoporosis. Why is that so important?
Imagine your bones are like scaffolding. Weight-bearing exercises like walking, jogging, dancing, they stress the bones,
Okay.
which makes them become stronger and denser.
Makes them work harder.
It's like resistance training for your skeleton.
I love that analogy. It's not just about building muscle.
Yeah.
We're building stronger bones, too.
Exactly. And the sooner we start incorporating weight-bearing exercise, the better.
Okay.
It helps build bone density during those key developmental years.
This has been such a fascinating dive into fitness across the lifespan.
It really has.
It's amazing how much we can adapt exercise to benefit people at every age, even with chronic conditions.
It truly highlights the power of personalized fitness and knowledgeable fitness professionals.
Absolutely. So as we wrap up part one, what's one key takeaway you hope our listeners will remember?
I'd say the biggest takeaway is that exercise is a lifelong journey. It's not about a one-size-fits-all solution.
Right.
It's about understanding how our bodies change over time and finding ways to move that we enjoy
Yeah.
and that support our well-being.
Love that.
Yeah.
It's about celebrating what our bodies can do, not punishing ourselves.
Yeah, exactly.
And remember, it's never too late to start or to adjust your approach to fitness.
It's never too late. There's always something we can do to improve our health, no matter what challenges we face.
So true.
It is.
Great insights. We're going to take a quick break and be back soon with more from our deep dive into fitness across the lifespan. Stay tuned.
All right. See you in a bit. So, we were just talking about how important exercise is during pregnancy.
Yeah, so many changes going on.
Big time. But now let's shift gears a little bit
Okay.
and talk about how exercise can be adapted for people managing chronic conditions.
Right. Chronic conditions. This is where I feel like, having a trainer's expertise is
Yeah.
really valuable.
Oh, absolutely. Chronic conditions, they come with unique challenges, but they definitely shouldn't be roadblocks to staying active.
Totally. So let's start with heart disease, something that affects millions of people.
Right, heart disease. Big one.
Yeah. So for fitness pros working with clients who have heart conditions, what are some of the key things they need to know?
I think understanding the basics of what's happening in the body is super important.
Okay, the physiology.
Exactly. Think of your arteries like highways. With heart disease, those highways can get clogged with plaque.
Okay, I've heard that analogy.
It's a good one, right?
Yeah.
That plaque restricts blood flow, which increases the risk of heart attacks and strokes.
Yeah, definitely not good.
No, not at all. And that's where exercise, particularly cardiac rehab, can really help.
So it's not about avoiding exercise completely.
Right. It's about doing it the right way,
Safely.
safely and effectively under medical supervision.
Absolutely. So fitness professionals need to understand those different phases of cardiac rehabilitation.
Yes, it's a medically supervised program, usually after a heart event, like a heart attack.
Okay, so it's really about being part of a healthcare team.
Exactly. We have to work together, monitor vital signs, understand the impact of their medications, and tailor the intensity and duration of the exercise to what they can handle.
Really personalize.
It has to be. Now, what about cancer? We know exercise is becoming more and more recognized as beneficial for patients and survivors.
Absolutely.
Yeah.
It seems like such a positive thing to incorporate.
It really is. It can help manage fatigue, improve mood, even potentially give the immune system a boost.
Wow, that's powerful.
It is. But again, just like with heart disease, we have to personalize everything.
Okay, so the same principles apply.
Absolutely. The type of cancer, the treatment side effects, their overall health, it all matters.
Makes sense. So working with those healthcare providers is key.
Couldn't agree more. All right, let's move on to diabetes. It's another chronic condition that's becoming more and more common.
Yeah, diabetes, we hear about it all the time. And I know exercise is often recommended for both preventing and managing type 2.
Right, so exercise helps by improving insulin sensitivity.
Okay, what does that mean?
It means your body can use glucose, sugar, more effectively.
Okay, got it.
And it also helps with weight management, which is a big factor in both preventing and managing type 2.
Makes sense. So what are some things to keep in mind specifically when working with clients who have diabetes?
Well, monitoring blood glucose levels is super important.
Okay, so before, during, after exercise.
Exactly. And we also need to teach them how to recognize the symptoms of hypoglycemia, which is when blood sugar gets dangerously low.
Yeah, you want to mess around with that.
No, definitely not. We need to make sure they know how to manage it.
Being prepared is key.
Absolutely. Now let's switch gears a bit and talk about pulmonary disease.
Okay, pulmonary disease.
These are the conditions that affect the lungs, making it harder to breathe.
Right, so things like asthma, COPD.
Exactly. I imagine exercise must seem extra challenging for people with lung conditions.
I would think so, yeah.
It can be, but it's still so important.
Okay, good.
There are two main types: obstructive, like asthma and emphysema, and then restrictive, like cystic fibrosis.
Okay, so two different categories with different challenges.
Right. But even with modifications, exercise can really help. It can improve lung function, strengthen those respiratory muscles, and just make their lives better overall.
So it's about breathing easier, moving more freely.
You got it. And finally, let's touch on osteoporosis. This one weakens the bones, increases the risk of fractures, especially as we age.
Right, and I know weight-bearing exercise is often recommended for osteoporosis.
Mm-hmm. It is.
Why is that so important?
Well, picture your bones like scaffolding. Weight-bearing exercises like walking, jogging, dancing, they all put stress on those bones.
Okay, so they have to work harder.
Exactly, and that makes them stronger and denser.
It's like weightlifting for your skeleton.
That's a great way to put it. It's not just about building muscle, it's about building stronger bones, too.
I love that. And the earlier you start with these exercises, the better, right?
Absolutely. It helps build that bone density during those crucial developmental years.
So important. This has been such an eye-opening discussion about fitness and chronic conditions. What a complex and fascinating topic.
It really is. There's so much we can do to adapt exercise for different needs and challenges.
And it really underscores the importance of having a knowledgeable and compassionate fitness professional to guide you on that journey.
Absolutely. So, what's next? Ready to tackle another aspect of fitness across the lifespan?
I'm ready for more. This deep dive has been so insightful.
It's been great, hasn't it?
It really highlights how much we can adapt exercise to benefit everyone, at any age and with any condition.
Yeah, exactly. That's the beauty of it, that personalization.
Totally. So as we wrap up our exploration of fitness across the lifespan, what's the one key takeaway you hope listeners will walk away with?
I'd say the most important thing to remember is that exercise is a lifelong journey.
Okay, a journey.
Not a destination. Right. It's not about finding this, one-size-fits-all solution that works for everyone.
Right, so individual.
It is. It's about understanding how our bodies change over time
Mm.
and then finding ways to move that we genuinely enjoy.
Yeah, and that actually fit into our lives.
Exactly. And that support our overall well-being.
So important. I love that. It's about celebrating what our bodies can do, not punishing ourselves,
Yeah,
right?
yeah, you got it. It's about moving because it feels good, because it makes us feel alive.
Exactly. And, it's never too late to start
Never too late.
or to, change things up, adjust your approach to fitness.
Couldn't agree more. There's always something we can do
Yeah.
to improve our health, no matter what challenges we might be facing.
Such an important message. It's so empowering.
It really is.
Well, this has been an incredible deep dive. Thank you so much for sharing your expertise with us.
Oh, it's been my pleasure, truly.
And thank you, listeners, for joining us on this journey. We hope you feel inspired and motivated to embrace movement at every stage of life.
And remember, keep learning, keep exploring, and most importantly, keep moving.
Until next time, stay active and be well.